welcome. Today we'll talk about septic shock. Let's start our lecture for today. Before we'll talk about septic shock, we'll talk about sepsis, which is defined as life-threatening organ dysfunction. And the definition of organ dysfunction is defined as an acute change of total sequential organ failure assessment of scores 2 or greater than 2, greater secondary to the infection cause. Septic shock is defined by persistent hypotension requiring vasopressors to maintain a mean arterial pressure greater than 65 mmHg and serum lactate level greater than 2 millimole per liter or 18 milligram per deciliter. Moreover, sepsis eliminates the requirement of the presence of systemic inflammatory response syndrome to define sepsis. Signs and symptoms as confined fever greater than 38 degrees or chills less than 36 degrees. Fatigue, anxiety and confusion, nausea and vomiting. Other symptoms as head and neck infections, chest and pulmonary infections, and pulmonary infections, cardiac infections, abdominal and gastrointestinal infections, bone and soft tissue infections, skin infections. Diagnosis can diagnose by using lab investigations as complete blood count, coagulation studies as prothrombin time, activated partial thromboplastin time, fibrinogen level. Blood chemistry as sodium, calcium, potassium, magnesium, phosphate, lactate, glucose. Renal and hepatic function tests as creatinine, blood urea nitrogen, bilirubin, alkaline phosphatase, alanine, aminotransferase, aspartate aminotransferase, and albumin. Blood cultures, urine analysis and urine cultures, gram stain of and culture secretions and tissues. Also, we can use imaging studies as chest and abdominal radiography, abdominal ultrasonography, computed tomography of the abdomen and head. Moreover, we can use lumbar puncture to indicate clinical evidence or suspicion of meningitis or clinical evidence or suspicion of encephalitis. Management. Treatment of patients with Septic shock has the following major goals, which to start adequate antibiotics, resuscitate patients from septic shock using supportive measures, identify the source of infection, and maintain adequate organ system function. Our management principles will be early recognition, early and adequate antibiotic therapy, and early hemodynamic resuscitation and continued support, proper ventilator management with low tidal volume in patients with acute respiratory distress syndrome. The pharmacotherapeutic management, including alpha beta adrenergic agonists as norepinephrine, epinephrine, phenylephrine, vasopressin, dopamine, dobutamine. Isotonic crystalloids as balanced salt solutions and lactated ringer. Volume expanders as album. Antibiotics, for example, third generation cephalosporin as cefotaxime and ceftriaxone. Fourth generation as cefepime. Meropenem, clindamycin, metronidazole, vancomycin, levofloxacin, ciprofloxacin, impenem and celestin, piperacillin and tazobactam. Moreover, we have corticosteroids as hydrocortisone and dexamethasone. Thank you so much for watching our video. Please don't forget to subscribe, like, and share the video. See you soon.